Welcome back. Well, according to the World Health Organization, clinical manifestations of COVID-19 are generally milder in children compared with adults. Some children, though, do require hospitalization and intensive care. Recent reports from Europe and North America have described clusters of children and adolescents requiring admission to intensive care units with something's called the multi-system inflammatory condition. Now, to help us understand these and other issues possibly associated with COVID-19, we're joined via Skype by Professor Jeffrey Mphahlele, a virologist and the Vice President for Research at the South African Medical Research Council. Professor, it's a pleasure having you on the program.
Thank you for having me.
So, as we contemplate sending our children back to school, there are still so many unknowns with regards to COVID-19. The World Health Organization tells us that the risk of severe disease and death has been highest in older people and persons with underlying conditions. Now, we hear about clusters of children and adolescents requiring admission to intensive care units with this multi-system inflammatory conditions. Some call it a syndrome. What do we know about this?
We don't know much about this inflammatory syndrome, so it's early days to make any judgment. I think what is needed really is for a number of countries to start looking more and more in children, because we have been thinking that the disease is quite mild in children, but now we are surprised as we see these cases emerging in some countries.
So what?
And in South Africa is something that we need to be on the lookout for.
What should they be looking out for? I mean, we're getting reports that doctors are investigating over 100 children in the United States. Are doctors likely dealing with a spectrum of disorders here? What are the symptoms that we're talking about?
The first thing is that we need to start monitoring how many cases of COVID-19 disease we get in children. And those children who have got severe disease and presenting at hospitals, we need to start screening for these symptoms. So clinicians should be on the lookout for, inflammatory diseases or syndromes like the ones described in the US and the UK. And it could also be that in other places, in other settings, the syndromes are not necessarily the same. So it's hard to tell. And it is really hard to make a general statement at this stage because we are still learning so much about this disease. And that's all we can say at this stage. So we can't really say much.
So exact symptoms, what, say, for instance, a parent sitting at home are worried about, you can't elaborate on that further in terms of the symptoms that we're talking about here?
Well, I can't elaborate on that, first of all, because I'm not a clinician who is looking after COVID-19 patients. Okay. That's number one. Number two is the fact that we don't know much about these few cases that have been reported. We hear that in the US, some children, about 93 or so, had these strange symptoms, and the symptoms are not necessarily the same. And some children, unfortunately, already died because of COVID-19. The most important thing that we are now understanding is the fact that COVID-19 may not necessarily be mild in children, as we always thought.
Yeah, that's very interesting indeed. I mean, any particular reason as to why we are only learning about this now? I mean, 4 or 5 months later since we first heard about this COVID-19. Any particular reason for that?
The only reason that I can advance at this stage is the fact that the virus will always behave differently in different populations. So what we have learned from China and many Asian countries may not necessarily be the case in Europe or in the US or in Africa. So this is the reason that we have to do research in different continents to understand how the virus behaves in different settings. So that's really the main reason that I can put forward at this stage. So there are still many things that we will learn as we understand the virus more and more.
So what are we learning with regards to how this virus affects men and women differently? Reportedly, there's a new study that shows there's a key enzyme which might explain why the virus hits men harder than women. What do we know about the study?
Well, on that front, we are still learning, and there are a number of studies that are showing that men are the hardest hit by the infection, and in fact, they tend to succumb to COVID-19 disease more than women. We don't fully understand why they succumb to the disease more than women, but there has been a study published in the European Journal, and this study has looked at the concentration of plasma ACE2. ACE2 is an enzyme, and it's also a receptor, very much like CD4 is a receptor for HIV. So the full name is actually angiotensin converting enzyme 2. And what the study has shown is that you get high concentration of this ACE2 enzyme in men than women. The only shortfall of the study is the fact that they actually looked at the plasma or the blood samples from men and women who were suffering from or who suffered heart failure. So one needs to be careful how you extrapolate these results to COVID-19 because the study population did not have COVID-19 disease.
Right.
But the mere fact that men had more concentration of ACE2 enzyme, which acts as a receptor to facilitate the entry of COVID-19 virus into our cells. I think that is a significant finding, and it can explain why we have got more prevalence of COVID-19 infection in men.
Right.
But in my own opinion, I don't think it does explain conclusively why we have got the worst outcome of COVID-19 disease in men, because having high prevalence of infection and having a worse outcome of infection are two different things.
Right. Still so much to learn about this disease, COVID-19. What do we know about the way coronavirus is evolving? What do we know about the mutation of the virus? I heard a reporting recently saying that a strain of the virus which spread in Europe in March is different from the one that came from China. Is that correct?
So it is correct in a way that if you look at the virus population, even in the same patient, the genetic makeup of the virus population is never the same. So what this means is that you will always have the different or variation in the genetic makeup of the virus population in different populations, regardless of the geographic location. And the fact that we have got this virus all over the world, it means that every time you sequence and you study and characterize the genetic makeup of the different strains circulating in the world, the genetic makeup will never be homogeneous. But that is not really a big deal in terms of the impact of the virus. The big deal becomes when this variation in the genetic makeup it becomes so significant because they can actually impact negatively on the public health measures that are in place to mitigate the virus.
Right.
For example, if there is a significant variation in the genetic makeup of the virus, you can get different rates of transmission of the new strain. You can also get a situation where the severity, or rather the progression and severity of the disease is different because of the new strain. And this new strain can actually undermine the diagnostics that are in place to detect the virus because we may not be able to really find it in the samples because of the mutations. And the last thing is that it can undermine the efforts to develop new therapeutics and vaccines.
Well,
this is when it becomes important.
Let's talk about that and its impact on the race for a vaccine. I mean, we've heard recently from the Trump administration signaling that we could have a vaccine by January. Some are saying end of the year. The initial thoughts were we were about 12 to 18 months away from a vaccine. How will this mutation affect the race for a vaccine?
At the moment, there is no cause for concern because the genetic makeup of COVID-19 virus seems to be very stable. And I don't think that the slight mutations that we see with the different strains of the virus circulating globally will affect any development of a vaccine. So we don't really have any reason to be worried.
Right. Professor, just looking at how lives have changed with regards to COVID-19. Earlier, we brought our viewers the funeral service of Dr. Clarence Mini, and very striking what you see from a funeral service. There is the constant wiping of the microphone, the wiping of the surfaces. People are spread out. The physical distancing that we talk about. Everybody's using a mask. From your observation, is this enough when we have gatherings like this? Is it enough to slow the spread of COVID-19?
Unfortunately, because we don't have any biomedical intervention in the form of treatment or vaccine, this may not necessarily be enough, but is what we have to try and mitigate the spread of the virus. So it is important to maintain social distancing, and it is important to disinfect the areas where people are touching, and especially the areas where people is a communal area, like the podium that everybody is using, and the microphones. So it's not really enough, but it goes a long way to try and mitigate the spread of the virus. So at the moment, I wouldn't say really we have enough measures to mitigate the virus. But whatever is available, whether it's wearing of cloth masks or social distancing or disinfecting your hands or washing your hands as frequent as possible with soap, all these measures are important to control and minimize the spread of the virus.
I guess without a vaccine, our options are pretty limited. So following the hygiene protocols is so important at this time. Professor, thank you very much indeed for your time and for your insight as well. Professor Jeffrey Mphahlele, a virologist and Vice President for Research at the South African Medical Research